Good afternoon. I'm Jennifer Bender, one of the Public Information Officers with the Watertown Area Task Force in response to the COVID-19 pandemic. We have a great lineup of presenters today with a variety of different healthcare entities in Watertown. But up first, we have Mayor Karen with a community update.
Good afternoon. Today is Thursday, June 4th, 2020. In South Dakota, 87 people are now hospitalized with COVID-19. 62 people have died in our state. Cottington County now has 38 cases and 29 have recovered, so that leaves only 9 active cases in our county compared to 17 last Thursday. In our 9-county region, there are 22 active cases today, down from 50 1 week ago. So this is Clark, Day, Dual, Grant, Hamlin, Marshall, Roberts, and Spink counties. And they're people that use our hospital, our stores, our restaurants, and our recreation facilities. Tonight is the first night for Thursday Night Live in our community, and it starts at 6 p.m. I'm really excited about this. I firmly believe we can do this safely. And if you're comfortable coming out, please maintain a social distance of about 6 feet from other people. We believe that's the way that people are mostly picking up and sharing the disease is by being too close to other people for a long period of time. So try to keep your social distance. Wear a mask in case you're infected. If you wear a mask, you'll keep from infecting someone else. And if they wear a mask, they'll protect you. So it's good to wear a mask. If you're not comfortable wearing a mask, that's your decision. We want everybody to use their own personal responsibility to do the right thing. It should be a fun time. I think that it also might be a good idea to bring along a little container of hand sanitizer if you have that. Keep yourself clean. As a community, we have been listening to lots of rumors about stuff going on, and most of them are not true. We are fortunate in our community that we stand together for peace and for all people without discrimination. And we support law enforcement. So together we are strong, and just want to keep that in mind. If you see something you're not comfortable with, then just say something or stay away from it. So today we have Heather Opal from HighV Pharmacy that's going to speak, Dr. Prairie from Sanford Clinic, he's a pediatric physician, Lori Feber from Prairie Lakes Healthcare System, and Carrie Johnston from Human Service Agency. And up first is Heather.
Good afternoon. I'm Heather Updahl from HighV Pharmacy. Just wanted to let everyone know today that pharmacies do play an important role in providing medicine and vaccines and health services to the public. And to ensure that pharmacies can do that during the COVID pandemic, that's been really important to us and to the community as well. To be able to reduce the risk for patients, we at HighV and all the pharmacies are encouraging patients to utilize the contact-free services that are available. Some of those services that are available to decrease their risk of exposure are home delivery. We offer that, and I know some other pharmacies in town also offer that. The drive-through is very important. Sometimes it does get very backed up. We do understand that. We now have provided a phone number where you can text your last name and your first name into the pharmacy so we can have your prescriptions ready and over at the window just to try to speed that process up. We also offer mail-outs. Mail-outs are very important. If you're concerned about coming to the store, and a lot of people are concerned, go ahead, call us. We mail out every day. It's a free service that we do offer. For customer and employee safety, the pharmacy staff, we are all required to wear masks every day. We've also instilled the plastic shields in front of all the registers and at the front of the first computer just to help minimize the contact. We also ask patients if they could call in their prescriptions instead of bringing in their empty bottles, just one less place where we have to touch each other's bottles. Also, we've requested doctors if they could utilize the automatic prescribing or electronic prescriptions instead of sending a paper prescription. We also sanitize between every customer. We do that at the shields. We're sanitizing those. We also sanitize the container where we send those out in the drive-through. So the process does take a little longer, but just know that we're doing it for the patient's safety. We also provide hand sanitizer at every register. We encourage patients to call ahead, make sure everything is ready so they don't have to wait in the waiting room for long periods of time. And when they are in the waiting room, we've got the little spots on the floor that are asking just for social distancing with a good 6 feet apart or more if we could. And again, we've got that phone number now for the drive-through. If you would just go ahead and send your last name and your first name in, we'll have everything ready. Just makes that process quicker. Vaccinations, that's a very important topic. We're just starting to give vaccinations again. We had quit doing that, just trying to make everyone safe. But it is important. We're looking at flu season coming up very quickly, and so we had to come up with some processes that were going to work well for patients and to keep the staff safe also. Staff, of course, will be wearing masks. We'll be wearing gloves. Patients, we're asking you to please wear a mask when you come in for your shot. Right now we're just doing shingles vaccinations, but the flu shots will be here before we know it. So if you're going to wear a mask, we're going to ask you to use a little hand sanitizer. We will fill out your form for you. You will just sign it, so there's little contact for you. Just trying to make everyone safe. That's our main goal. Hopefully we can do that. We just want to make sure that patients still have access to their needs. Medications, of course, are very important. And if we can minimize the risk to the patient and to the customer, that is, and to the pharmacy staff, that is the most important thing. And we're doing that by infection control and social distancing. Thank you. Next, we'll have Dr. Prairie.
Well, I'm Dr. Tracy Pratt. I'm a pediatrician at the Watertown Sanford Clinic. And I'm really just here to reinforce a lot of the things that she said, but also to reinforce that it's really important that you do continue to get your medical care, and I'm specifically talking about kids. It's important that even during the pandemic that you still bring your kids in and still have their wellness visits. It's okay to keep your regular scheduled appointments. It's safe. It's important that we encourage that. Managing medical conditions is important, especially for conditions that require monitoring, things like asthma. It's important that you do get your medicines. It's important that you are following up, because if you do get the COVID virus, you're going to be more susceptible if your body isn't healthy. And that includes kids as well. So it's important to do come in and be seen. Nationwide, it's noted that healthcare is seeing a lot of decline in wellness visits, and there's a lot of delays in making these screenings that are not being done, and so kids are missing out on those. They're missing sometimes opportunities to get their evaluations and get plugged in for services to help catch them up. Physical therapy, occupational therapy, speech, all these things are being delayed just because of the past couple of months. And so we want you to get back in and get those things started back up. Vaccinations, as has already been noted, have been really down. If we compare last April to this April, vaccinations are down 50% compared to last year in our system, and that's very concerning. We have to worry about a resurgence of other illnesses and vaccine-preventable illnesses that we have been vaccinating for years. We don't want those to come back. We've had whooping cough come up in the past month in the area, and that can be, as we know, fatal to infants. So we do have to continue to get our vaccines and know that it's important, even in this time, as we said, with the COVID virus that's out there. We know that there's some things that we can do that are not in the clinic. You can do some things that are not face-to-face, but there's a lot of things you can't do with telemedicine, and you just have to come in. So we are implementing lots of safety measures that have really already been discussed earlier in the week and also just recently. There's a lot of PPE and face masks that all the caregivers are wearing. They're screened in our clinic every day when we come in. We have to be screened with temperature screenings and questions. We're limiting visitors. We're also doing plexiglass and social distancing in the clinic setting as well. And there's been a lot more cleaning efforts that have been done in the clinic and even in the hospital setting. So know that the hospitals, the clinics, they are safe places. So don't avoid because of the fear that it's a dirty place. They are not. They're probably of the cleanest places in town, to be honest. So don't put off your kids' healthcare needs. Do come in, be comfortable, and understand that we know a lot more about this illness. And so we're taking precautions, and know that the rest of your health care is just as important as avoiding COVID. And that's for your own well-being. Thanks. Lori.
Hello everyone, I'm Lori Fieber and I'm the Director of the General Surgery ENT and Outreach Clinics at Prairie Lakes. Since March, we have made many changes within the clinic setting to ensure your safety and to help with accessing the care option that best meets your needs. It was just a handful of weeks ago that the majority of clinic visits were being transitioned to telehealth. At that time, with all of the unknowns and the potential surge, we were recommending patients to stay home and complete their clinic visit via telehealth. While this continues to be a great option, we realize that it is not ideal for all types of visits. Starting in May, we gradually opened up our clinics as the number of positive cases in our service area remained low, and we began seeing patients in the clinic setting. Currently, the Prairie Lakes clinics are seeing a combination of the telehealth visits with the in-person clinic visits. We want to stress that the safety of the patients and staff is always at the forefront. Because of this, when patients come to their appointments, it is going to be a bit different from prior to COVID-19. How the process at the Prairie Lakes Specialty Clinic works is that the ENT clinic and the Cancer Center is that each unlocked entrance there is a screening station. All staff, physicians, and patients are screened prior to entering the building. The screening is going to include having your temperature taken and being asked the screening questions regarding any signs and symptoms such as fever, cough, sore throat, chills, muscle pain, shortness of breath, and a new loss of taste or smell, and if you have recently been tested for COVID-19. We ask that if you have any of these symptoms, you notify your provider that you are scheduled to see and that you follow up with your primary care provider. If you have any of these symptoms upon arrival, you will be masked if you are already not wearing one, and the provider you are seeing will be notified for further steps that may need to be taken. Keep in mind, it is likely that you may be asked the same screening questions numerous times throughout your visit. You'll notice at the registration desks now there is a plexiglass barrier to increase protection for patients and staff, and that the registration staff will also be wearing masks. The waiting rooms have been rearranged to have increased spacing for patients to follow the social distancing guidelines, and there is increased cleaning in all registration and waiting room areas that occur numerous times throughout the day. Patient care staff, along with providers, will be wearing a mask and at times may also be wearing eye protection and a face shield. We also ask that as a patient, you use the hand sanitizer station upon entering and exiting the clinics and maintain social distancing recommendations of 6 feet, not only in the waiting rooms, but also if waiting in line to be screened or for registration. Although at this time we do not require all patients to wear a mask, we do strongly encourage if you have a mask to please wear it. We are also continuing with our no visitor policy at this time. We realize this is different than Brown and Sanford Clinic, and we are continually reevaluating our policies on a weekly basis. For the clinics, we do have some exceptions in place to allow one person to accompany to an appointment, and those exceptions are if the patient is a minor, patients with a new cancer diagnosis, and patients with altered mental state, including confusion and developmental delays. For the hospital, these exceptions are in place also, along with end-of-life care and OB patients. If you have questions regarding the visitor policy, you can refer to the Prairie Lakes website or visit with your provider's clinic staff. Because of the great job that the communities in our service area have done in following the guidelines, we have thus far been able to maintain a lower number of positive cases. We want that number to stay low, and we want to keep our patients close to home. We continue to be able to provide a number of specialty services for the region we serve, to include general surgery, ENT, cardiology, pulmonology, nephrology, dermatology, urology, wound care services, along with rehab, therapy services, and the cancer center. We also have outreach physicians that are coming into Prairie Lakes to provide vascular, allergy, plastic surgery, and infectious disease services. They also have the same safety measures put in place to ensure patient and staff safety. We will continue to work hard to maintain a patient-centered approach and access the care option that best meets your needs via telehealth or at an in-person clinic visit. We encourage you to keep your appointment, and through our increased safety measures, you can be assured local care is here and ready for you. Next up is Carrie.
Good afternoon. My name is Carrie Johnston with the Human Service Agency. I feel like Lori covered a lot of the good options that we're moving toward at HSA as well. The end of March, we moved all of our behavioral health operations to Zoom or remote locations where our clinicians were able to work from home and off-site. Some did stay in the agency, but the client was in the comfort of their own home. We were able to provide service via phone or on a Zoom call. We are continuing to do that, but we've also slowly brought people back into our office as we've ramped up some of our masks and hand sanitizer and our cleaner. So right now some of our staff are in-house and some of them are still working remotely. All of our groups are still provided remotely so that we can adhere to the CDC guidelines of not having 10 or more gathered in one room. We do have services might look a little bit differently. We do provide a disposable mask. Thank you to Star Laundry for those. For anyone who comes in for services, one thing about therapy or telemedicine is you can do it over the phone or through the Zoom lens, telemedicine, but also all you do when you're in person is talk. And so you're likely to cry. So we want to put a mask on so that you're not sharing those germs. And the clinician will also have a mask for your comfort and safety as well. We ask that you may wait in the car until your appointment and the clinician will come out and get you, or we have spaced our waiting room out so that there's 6 feet between chairs as well. We ask that you come alone unless you're the parent of a minor child that needs to come for therapy. We also ask that you, if you're not feeling well, you stay at home. One good thing about telemedicine for us too, with regard to therapy as well as psychiatric care, is if you don't feel well, you can still have your session. Just call us and we're able to provide that over the phone or again using that Zoom technology. But we don't want you out and about if you're not feeling well. And thankfully, we are able to continue to provide that service for 6 more months and bill insurance, at least 6 more months, billing insurance and state contracts so that we can keep everybody well and healthy. We are still not taking detox clients at the Serenity Hills right now just because we don't feel like the safety and the is there for all of our clients and our staff. Our care program, which serves our severe and persistently mentally ill, are looking at reopening their operations on 2/12 in the middle of June. New Horizons, we have our day program. We're looking at bringing those individuals back to the main agency for day programming in July, contingent upon how our numbers are going. We have started patio visits and window visits so that people can talk with their loved one and talk with their family member because isolation, it can really get to person. And on that note, to improve our mental health, I'm just going to review all the things that mental health we've been talking about and we've been preaching throughout the whole quarantine. Get exercise. The rec center has opened again, so follow those rules and get out and do some exercise class or get on a treadmill. It's been beautiful out. Go out for a walk or for a run or for a bike ride. Continue to eat healthy, get great sleep. Try to keep your news to a minimum, especially right now. Refrain from social media. Try to stay connected with people best that you can, whether it's texting, calling. Maybe you are able to go for a walk with someone and they have a social distance. But more importantly, and I can't stress this enough, practice forgiveness, acceptance, compassion, understanding, and empathy. Constantly judging other people is emotionally exhausting and just not worth it. If our heart feels good, we feel good. And above all, reach out if you need help. HSA does have a 24-hour crisis line. You can call us at any time, 886-0123. Thank you.
Good afternoon. I'm the other Public Information Officer with the Watertown Area Task Force. At this time, I just want to announce we are doing the food distribution event that is going on here probably in about the next 7 minutes. That's going to start. That's up at the Boys and Girls Club of Watertown. And to participate in that, what you want to do is line up starting at Highway 81 and Arrow Avenue, and you're going to go east on Arrow Avenue all the way to 9th Street. Then it'll be directed north to the Boys and Girls Club of Watertown. And you can't access that from 3rd Avenue, and please do not line up before 4 p.m. And that event will go on as long as supplies last up there. So again, that's the food distribution taking place here in just a couple minutes up at the Boys and Girls Club of Watertown. That is all the things I have to say here today. But this time we'll turn it over for any questions from the media, if there are any. All right, hearing no questions from the media, at this time we'll end the daily briefing, and we'll see everyone back here on Tuesday at 3:30 p.m. Everyone have a safe and fun weekend. Thank you.